Guys, we're in the middle of the pandemic and these are trying times. It's hard on our mental health, our mental state. And this is why I love our sponsor today, BetterHelp. They're the largest online counseling platform worldwide. They change the way people get help with facing life's challenges by providing convenient, discreet, affordable access to licensed therapists. BetterHelp makes professional counseling available anytime, anywhere, through a computer, tablet, or smartphone. It's brilliant. Sign up today. Go to betterhelp.com/solvinghealthcare and get 10% off sign-up fees. Welcome to Solving Healthcare. I'm Kwadwo Kyeremanteng. I'm an ICU and palliative care physician here in Ottawa and the founder of Resource Optimization Network. We are on a mission to transform healthcare in Canada. I'm going to talk with physicians, nurses, administrators, patients and their families because inefficiencies, overwork, and overcrowding affects us all. I believe it's time for a better healthcare system that's more cost-effective, dignified, and just for everyone involved. Podcast Nation, we have a beautiful episode for you. We are talking with Dr. Tracy Hoeg. She is MD, PhD, got a PhD in epidemiology and public health, and she was one of the authors of the Wisconsin Wood County studies looking at the risk of in-school transmission. And basically, I don't want to ruin it for you, but just really illustrating how schools are safe, how they're not as much of a major source of spread as we think, how when COVID comes into schools, tends to come from outside in, from the community, and tends not to spread within those doors. This was a very enlightening study that the CDC also published. So we had to talk to Tracy. We had to pick her brain, talk about what she thinks about schools openings, getting her input on vaccinating our kids. We talk about as well the risk of outdoor transmission with kids. And we even dive a little bit into asymptomatic testing when we think that's warranted. This is a beautiful episode. Before jumping into it, let me tell you about some of our initiatives. Solving Wellness. We're kickstarting that bad boy. You want virtual workouts, yoga, cooking and nutrition advice, self-care, meditation. We're doing it all. It's all focused on healthcare providers because we want to address that burnout. We want to make sure that our healthcare providers are at their finest, especially during this tough time, especially during this pandemic. So check us out, solvingwellness.ca. Sign up and be part of that community. We're changing that bookie, yo, for real. All right, listen, without further ado, I'm going to bring Tracy in the mix. Once again, native from Wisconsin, originally from Denmark, currently board certified physical medicine rehabilitation physician working out of Northern California. Man, she's something special. So without further ado, Dr. Tracy Hoeg. Podcast Nation. I am super jazzed up to bring to you Dr. Tracy Hoeg, or Dr. Tracy Hoeg. Sorry, guys. I tried to represent the Danish way of pronouncing this. Oh, Tracy, forgive me. I thought I was going to represent.
It was beautiful.
Oh, I love it. But thank you so much for joining. I don't know if you could tell how excited I am about this because I've been trying to track you down, and I did ask Monica to make the connection, but I'm certainly glad you joined the show. Welcome to the podcast.
Thank you so much. I'm so happy to be here. And I'm really a big fan of your show ever since Monica introduced me to it. So you've got a really good thing going here.
Oh, thank you, Tracy. Oh, okay. So let me ask you, you have been you're a big deal. You've been, in front of government officials talking about some of the study results when we're looking at kids, schools, and COVID. But where did it start? What drove you to make these evaluations?
Yeah, so I think it was because I saw a disconnect between what was happening in Denmark and Europe and the United States. And it was really concerning to me because I have kids, and I could kind of see from the beginning that the way we were looking at schools was not the way that, the Scandinavian countries and most of Europe were looking at schools. And it was in mid-April, that Denmark basically, they said, okay, well, we don't know a lot about COVID. We know that there's probably a big chance, but we're going to open the elementary schools before everything else because the society can't function if our kids don't have a place to go, right? So they didn't open any of the rest of the economy, and they opened the schools, and they like used, Boy Scouts, Girl Scouts clubs. They used Tivoli amusement park. They used all these sort of open spaces, and they got it to work. And the case counts only went down after they opened their schools, and then they kind of gradually reopened the economy. And in my opinion, I mean, they've had one of the best responses to the pandemic because they've had a limited amount of lockdown, and they always prioritized the children first. And when they did have lockdown, they had protections for people who were out of work so that you weren't missing income. And they've had one of the lowest death rates in Europe. I believe it's third after Norway and Iceland. So, wow. And all three of those countries have taken really similar strategies, but Iceland's lucky because they're isolated from the rest of the world. Mm-hmm. So that was easy for them.
Mm-hmm. So basically you saw this disconnect. You saw how the Danes were prioritizing the kids. Yeah. And you saw that it didn't seem to have a negative sequelae in terms of spread.
Exactly. Yeah. So then, so I thought that, okay, well, that's interesting. And now there's really nothing happening in the US in terms of getting kids back to school. And I kind of thought, well, we still don't really know. Maybe kids really do spread this disease a lot. At that point, it was April. And then, so Jennifer Kasten is an epidemiologist friend of mine. And she was the first person who kind of pointed out to me and started writing about the fact that there were these reports of kids not really spreading the disease. And when she pointed that out to me, I became really fascinated and started looking into the studies myself and looking at what was coming out of France. And they were just kind of, that when the schools were open in Ireland before the lockdown, before they even knew COVID was coming, there were no cases that came from the schools. And then there were like these reports of, students, who had 190 contacts and no one got sick. And so I thought, this is really different from other viruses, and this could have a huge impact on the way we handle the disease, because we knew early on that kids were fairly mildly affected by it, which was amazing. But the transmission part was something that came later, was kind of unexpected. And I could, as far as I could tell, it was like Europe was kind of grasping that, and the United States was like, our public health response was like, we can't get beyond the fact that kids are petri dishes. It's like, it was not in the psyche of North America. And I think in Canada somewhat too, that the kids might not be the same vectors of disease that adults are. And so I just thought it was interesting that it seemed like systematically we were ignoring the science about that, which seemed like it should have such a big impact on the school reopening. And so I just basically started writing all these posts about what was going on in Holland and how they were opening the schools, and it was going really well. And the kids didn't have masks. And, it was just kind of like they were just seeing what was going to happen, but also following the little science there was, and actually having good results with that. And then, I kind of thought, well, the US is going to catch on. I'm going to keep writing, about it on social media and see what happens, see people's responses. And then it was like, people went from being interested in it to the day that Donald Trump said, open all the schools. Like everyone that I knew just basically thought I was wrong all of a sudden because they said, whatever Donald Trump thinks, it's the opposite. So,
yeah, no, there's a lot of good points there because I think I don't know where we lost it. I think you mentioned Donald Trump. I think at some point this response became hyper political as opposed to data driven, which is what has personally been driving me absolutely nuts. Anybody that's listened to the show, it's just preaching like, what does the data tell us? And that's how our response should be. And I agree. Even my evaluation of the data, it was pretty clear that kids aren't major vectors of spread. Even personal stories where one kid would have it in the house and nobody else would get it, and I don't know. I just think it was something that was a hard concept to register for some, especially when you think kids are normally the opposite. Like you have 4 kids, if I'm not mistaken.
Yeah, that's right. Yeah.
We have 3. Like I'm during a normal, pre-COVID winter, like every 3 weeks we have a cold, like, you know what I mean? And so
yes, yeah.
I think maybe it's a bit of that culture, it's a bit of the political side, but it was so sad that we weren't allowing the data to drive our decision making when it came to our young ones.
Yeah, absolutely. And I don't ever want to give the impression that like kids don't spread it at all. Cause I remember in the beginning thinking, well, what if they really don't spread it at all? But I mean, that hasn't been the case, but they definitely have consistently been found to catch it less and to spread it less frequently than adults. And, that kind of also gets into what we found in Wisconsin, which, ended up, I know we're going to get to that.
We can jump. No, we can jump in there. We can jump in there, Tracy. I'm ready. This is what got me so excited. CDC sponsored, yo.
It was not CDC sponsored. So that gets me back to actually another point that I want to jump into before I even start talking about the study, which was like, why was the CDC not even looking at this? Why was there no sponsored research or anything about COVID in kids and schools and like people studying how to get the schools open safely? Like there has been nothing. I mean, everyone that I know who has been doing this is doing it as volunteer work. And it's because we all think it's so important. And, I just feel, so it's a misunderstanding that it was CDC sponsored, but they published it, which was great.
Yes, thanks for the clarification.
Yeah. So I mean, what we ended up doing was studying. It was like 5,500 students and staff in Wisconsin. It's rural Wisconsin, sort of in the middle of nowhere. So what we had was we got a donation of cloth masks for the students. And that was really the only funding, type of funding that we had for the study. And we studied them over 17 weeks. And at that time, the case rates in Wood County, Wisconsin were incredibly high. It was up to 41.6% test positivity rate. And I was looking at it, and over 5% of the entire population of the county got COVID during our study period. So it was like, and I think it was more because you have to understand, this is like rural Wisconsin, very Republican, like people are not going to be tested unless they really need to be tested type of mentality. And so despite that, we still found that there were only 7 cases that spread in the schools and no teachers got infected by students. It was, so we had a 37% lower rate of COVID in the school than in the community. But I do want to point out that it was only less than 4% of the cases that were in the schools came from the schools. It was the remaining 96% of the cases in the schools came from the community.
So that was brought into the school.
That's right. So it was like once the cases got into the schools, they didn't really spread further. At least that's what we found. And so, it really opened my eyes to like, wow, schools, they're a safe place for kids, it's like we have all these benefits of school that kids get to be with their friends. They get to learn. They're somewhere during the day while their parents are working. I mean, all the benefits that we know of, but then there's less COVID in the schools than in the communities. And I think what a lot of parents or a lot of people don't know if they're not a parent is it's like, kids need to be somewhere during the day while their parents are at work, especially if they're young. And that was our situation as my husband and I, we're both physicians and, we were like, okay, well, we're not quitting our jobs. And we literally had trouble affording putting them in daycare, which was the daycare that was right next to their school, where they were going to be sitting in one room with like 90 other kids doing Zoom without a playground, without any opportunity to go outside all day. And we were supposed to be paying, like $2,000 a month for that. And it was like, no way. And I mean, so I think that opened my eyes to like, what are people doing? What are essential workers doing? What are their kids doing while they're at work? Because obviously, people just can't up and quit their jobs. And so it's kind of two things coming together here. It's like, you've got this crisis where kids need to go somewhere and parents need to go to work, and there's nowhere for them to go. And then you've got this other, factor, which is the science of it, which is, schools actually look like they're really safe and probably safer for kids than daycares and, passing them around between grandmas and things. It's like, so there's two things that we're saying we really, should be opening up the schools and only closing them unless we absolutely need to. And then in the US, it's been like, well, schools have been closed for over a year, and it's still in California. I just looked, and only 37% of high school and middle school students have even gone back to the classroom at all yet. Wow. So it's like they haven't been in school for, over a year now. And if you look, the McKinsey report came out, and it was like, if kids miss school for a whole year and you start, the next year and they're doing it over Zoom school, they're basically going to start out lower than they ended the year prior. So it's like, it's crazy from an educational standpoint too.
It's unbelievable. And you make a lot of good points, Tracy. Like number one, these virtual platforms, this is, I've been saying, it's uncharted waters. We haven't really fully evaluated these things. We don't know the long-term implications on their education truly by doing these platforms. Two, we have not only the, Wood County data, but several other studies implying that schools are safe. The fact that even one of the worries in Ontario is that teachers are, they're vulnerable in the classroom. And, a lot of data showing that, when you compare it to them being in the community, it's actually not worse.
Yeah, exactly. Like there was a good study out of Scotland that looked at basically hospitalizations and severe COVID and compared teachers to other essential workers. And teachers had a lower risk of hospitalization and severe disease from COVID. And there the kids are back in school and they don't wear masks, so it's, I mean, that's a whole other story of how much masks are doing, but like they did have a lower risk there than other essential workers. So, I
definitely hear you. And the other aspect that we often forget about with schools too, like right now in Ontario, we're all hands on deck in our hospitals because it's, we're getting that heavy third wave. And, I worry about some of these healthcare providers that, for them to be frontline and the kids not in school, who's going to look after the kids, right?
Exactly. Like I know that there was a hospital in Arizona that started their own school because like all their nurses were quitting. Yeah. And probably not just nurses. I mean, just healthcare workers in general were quitting. And so I was like, wow, I mean, it is really sad that, the public school system like disappeared. At least in California it did for basically a year, and it's coming back very slowly. And then, we could talk about hybrid too, but it's like, well, why are we doing hybrid? Like, I do not understand why we're doing hybrid. We can now have the kids back. CDC says 3 feet of distance is enough. And it's, we could do if lunch is a big concern, it's not, it shouldn't be a super expensive thing to have kids eat outside or, like be a little bit creative with it. The whole, what's that?
I said, especially in California.
Yeah, right. Exactly. Maybe not everywhere, but the whole thing has really felt like, no one is working towards making it happen. It's just, I kind of worry even that kids get the sense that they're being deprioritized. Like my son just asked me today, he's like, oh, my friend, he's like, his friend is in public school. We moved our kids to a private school. And he said he only gets to go to school 2 half days a week. but that doesn't make sense. Why are there adults in restaurants without masks on? And that's okay. And I was like,
yeah,
that is a good question.
Well, you can't tell me, Tracy, that the kids haven't been deprioritized. Like there was even a push where we are that we were going to close playgrounds. And you close down schools, you close out playgrounds. They have no activities. We're good friends with a child psychologist. She's never been as busy as she has been. I've had people track me at work talking about how they're struggling with their kids left, right, and center. And
yes, I know I mean, these kids, they need to be outside. They need to play. I mean, this is the absolute safest environment for them to be in, is to be, outside. And the fact that we're closing playgrounds makes absolutely zero sense from a public health standpoint. And it's, we've seen the same thing with adults too, that it's like you close all outdoor things and everyone gets together indoors.
Inside, exactly. This is going off on a bit of a tangent, but it's worth it. It's like, I don't know who's making these policies, but for my point of view, locally, we kind of miss the boat on the outside, promoting outside activity, like really for not only mental health, physical health, overall well-being, reducing COVID risk. In fact, when we see so many obese diabetics, like just being outside, connecting with people outside, like, as an epidemiologist, like the risk of getting COVID outside. I mean, you can't see.
Oh yeah. It's less than 1 per 1,000 cases are spread outside. And like, you look at there was a youth soccer study that was done over last summer, and there were 91,000 youth soccer players. And there was only one case where they said potentially it was spread related to soccer among the kids. I mean, that is such an incredibly low risk and so many benefits for these kids for being outside. And, it was like lack of physical activity was the third highest risk factor for getting severe COVID after old age and organ transplant in a British, the British Journal of Sports Medicine.
Yeah.
I was like, see, we are not using those data and those studies to guide what we're doing. Like, I think a lot of public health people feel more and more like our response to this pandemic has been all about appearances.
100%. 100%. When like I just like I mean. Like locally too, we were when we had ice rinks. It was January. Everything was closed down, and they were like, kids can't play hockey outside. They could skate on the rink, but you can't use hockey sticks. I'm like, that's ludicrous. Focus on the big picture. At that time, it's like deal with long-term care, deal with essential workers, get vaccines rolled out. But don't tell me kids playing hockey is a risk, like a significant enough risk in the big picture. And I think I got in a little bit of trouble for that one. But honestly,
no, that's so true. I mean, if I get into like the situation, so I'm a consultant for the local diocese that our kids ended up going to school at. And, basically I was able to kind of show them the data about outdoor transmission and kids transmission. And so they ended up, changing the rules so the kids could go outside, play with balls, play at recess, play on the playground equipment. And it has, it's made such a difference in these kids' quality of life. Like my kids really started enjoying going to school. They had more friends. And, and I just want to say, because I think a lot of people don't know about our Wood County, Wisconsin study, that the kids in our study were out at recess without masks on, playing with all the playground equipment that they wanted to. And we still saw such low transmission. That is not unexpected. And so, I think I can't state enough that, outside is where people should be, where it's the safest. I think that's finally getting out. And then hopefully it sounds like there's going to be some changes in rules from the CDC soon about wearing masks outdoors. But masking outside, especially during exercise, really never made any sense.
Yeah. I mean, what we know, indoor sustained proximity to somebody with COVID, this is the risk. And, we have unfortunately an ICU full of COVID patients right now, and I don't know a single one that was related to an outdoor transmission, and
yeah. Well, the data supports that. And yeah. And I just want to be very clear that, part of the reason that I got so interested in studying kids and COVID and doing all this work is not just because of the interesting aspect of the kids, but because, I really take COVID seriously. And, it's been absolutely devastating. I mean, especially for older people. And I was terrified of my parents getting it, and, what's happening in India right now. It's absolutely terrible. And, my way of thinking and, the reason that I've, dedicated so much time to it is I feel like we need to have a more sensible and a more like high yield response to this. And it's got me thinking too about like global vaccination strategy and, prioritizing vaccinating older adults and adults across the world before we vaccinate kids if they're less severely affected and don't spread the disease as much. But the whole time we should have been really focusing on, where we knew the disease was spreading and what the highest risk things were. And instead we were focusing on like shaming people for like not having a mask on, running on a trail. And I don't know. It was a shame. Lots of energy wasted.
I don't know if this would change it if we have if and when we have another pandemic, but I do hope, I should say when, that we do learn that let's let the data drive our decisions. We'll have way better outcomes, way better, instead of trying to, use our judgment or I don't know.
Well, and it's all been very emotional. It's been, and also like you've already alluded to, it's like these two camps, right? And it's the people who have, Democrats who want to, they're in the camp of we take, and I say they because I'm not going to say I'm Democrat or Republican. I'm just going to stay out of it. So I'll say they. So like Democrats say like, we want to take all these measures to stop COVID, but, they're also the political party that historically has been like, we need to give more attention to homelessness and joblessness and kids who are underserved, getting better education. And it's like, then the party just like ended up focusing 100% on COVID and like 0% on, the other very important work that they were doing. And it led to a really bad situation that was really unbalanced and ended up, leading to a lot of unnecessary lost lives, not just from COVID, but, I think that there's, well, maybe not, maybe we don't have the data on suicide yet, but there's certainly been a lot of anguish and poverty and, difficulties, psychiatric illnesses for people. And we're going to see ripple effects from the children not having access to education and for decades, so it's.
I mean, Tracy, even within our country, like I know I think I heard Vinay say this and I never thought that hard about it, but like, do we really want to wait before suicide numbers go up? Like, it's like, I know. Like, it's like a extreme end to things. You know what I mean?
Well, and what I have to say about that is it's really hard to get up to date data on suicide numbers. Like I've looked into it and it seems like it takes almost a year for it to catch up in the national database. And, Jean Noble at UCSF has been doing really important work, and she's been finding in the ER that they're admitting, like it's gone up 75% how many kids they're admitting for psychiatric illnesses. And it's like, okay, so we know that there's like a crisis, and that is San Francisco. Right now, they only have 10% of all their kids in school. It's like totally ridiculous because they have such low case numbers there. And yet they have this like mental health crisis among their youth, Yeah,
that's unfortunate. I think that's coming. But the other thing that was a bit, I thought disturbing, no press, like local press or like national press in Canada picked this up. But when one of our government bodies looked at excess deaths 2020 compared to 2019. And about half of them were related to COVID, but the other half were related to like whatever, like whether it's suicide, substance abuse, MIs.
Exactly.
Like, and this got no press. I actually legit send it off to all our media sources. I'm like, y'all got to cover this. And nobody covered this.
I know there's so many health conditions that are being ignored. And I know Monica Gandhi's talked about that too, with HIV and substance abuse, and like how it's just, HIV people not taking their medications. And it goes along with that like childhood vaccination rates worldwide have dropped by like over 30%.
Ridiculous.
And it's like, yeah. And it's like, okay, guys, these are the diseases that we are really worried about in kids, really worried about.
It's just, it's the one, it's like you alluded to, it's like, we need to be less myopic, in my line of work, you can't just look at the kidney. You can't just look at the heart. You got to look at the whole picture. You have to be having the holistic approach. And it's the same the way it's got to be with our kids. It's the same thing it has to be with society in general. Yes, we don't want to overwhelm the system with COVID. Yes, we don't want people to die unnecessarily, but we don't also want people to suffer from the consequences of our actions, of our restrictions. This is why I think even in our current state, imagine, I know this is it's more maybe on the Danish side than on the US side, but imagine if we said, yes, we're going to have to close down schools, but we are going to subsidize counseling for kids. Like if you feel like your kid's in need, we are going to provide that support, like some kind of like.
Right. Like we're actually in this together, not like you people just do what we say. But I will say in Denmark, I can speak to this specifically because when they closed the schools, they kept the free daycares open. So there was still always somewhere for kids of essential workers to go. And like the fact that didn't exist like on any level that I was aware of here is just like, how can that be? I mean, and I think that, also it's very impactful that you as an ICU doctor, and you've had other ICU doctors on who are like seeing people dying of COVID, and you're really, really worried about COVID, that you are standing up and saying, but all these other things are also really important. Like, there are other types of public health crises and we can't ignore those.
Yeah. And 100%. And it's just, once again, having that holistic view to just take that bird's eye view and say, like, what are we actually doing? Like every action has a consequence, and just thinking about it, think about 3 steps ahead, because like we said, Tracy, unfortunately, I think we'll have like a mental health crisis. We're going to have the delayed cancer. I've already seen some of the results of people either being too fearful or the delayed cancer screening. We've already seen people presenting really late.
Yes.
It's just like this avalanche, that keeps building outside of COVID. But
right. And now it's like, well, we have a lot of the population vaccinated now. I know Canada's not quite as many.
You guys are impressive
as we have, but it is like, what is the end game? Like, in California, I'll just give an example that is kind of driving me nuts right now. So in the LA Unified School District, where the teachers are over 80% vaccinated, and a lot of them are still teaching from other rooms, and the kids are basically like in these little plastic barrier desks where they're watching their teacher on Zoom. And then, I was in New York City, the same thing, where a lot of teachers are still teaching remotely and the kids go to school. And, I've been very clear from the beginning that I do not want to blame or fault teachers, because I absolutely love teachers. Like, I adore them. I have my whole life and I've had so many good teachers. But I worry that it's a problem with the public health messaging if, like, teachers without other health conditions are too afraid to go back to school once they've been vaccinated, when we already showed, studies have already shown that schools were so safe before teachers were even vaccinated. And now it's like, it's almost like there has to be someone to step in and say, like, stop the madness. We just need to start teaching our kids, like, in person. And really it's a shame that we can teach kids over Zoom, like that's somehow an option, or that's somehow become acceptable, because, from the beginning, we would have made it work by teaching kids outside, or like, some option that at least, gave kids somewhere to go, some way to learn. I mean, it's really a shame.
This is what I'm ultra anxious about, actually, Tracy, is the end game. Because a couple of things, like, one of the things when we add restrictions, when we add that extra layer, so locally they've been told that if you're going to go to a playground, you have to wear a mask. And so all these added layers is going to be harder to retract them when it's truly is safe to be able to.
Exactly.
You know what I mean?
Exactly.
And once again, I do think there are consequences there. Like I'll give you an example. I've said it on the show before, so forgive me, crowd. But when I had a buddy, actually, maybe I've never said this story. My 2-year-old, a buddy was coming to drop something off, and the 2-year-old started to walk towards him. And then he started to pull away, like, as if little Zeke is going to give him COVID from a quick interaction. And I'm like, what is he teaching? What's that teaching Zeke? People are afraid of you. Like this is not good. Like, I don't care what anybody's telling me. Like, this is not good. And
exactly.
And that having that extra layer of anxiety, that extra layer of, yes, we've been told that you're vaccinated and schools are safe, but yet the messaging is that I still need a teacher in a separate room in a hazmat suit or whatever. It is. I mean,
when you look at the data that showed, like, there have been a breakthrough infections after vaccination, there's been less than 1 per 12,000 in real life. It's like, people just kind of need to think about that risk. Like, it's way more risky to just drive to school in your car than it is to be in school. And I don't think that humans are very good at understanding risk in daily life. And
100%, 100%. But do you think it's our fault though? Or do you think it's like, when you hear about, when we give risk, assessment of risk, maybe it's better to be using analogies like that. You know what I mean? Like, I don't know
exactly. Like, numbers are kind of don't mean as much to a lot of people, right? And it's like, you just need to compare it to things that people know, and they'll be able to understand it better. It's like, it was very powerful, when we kind of saw, okay, kids are dying at a rate less than they die from influenza, from COVID. And then I was like, oh, okay, yeah. So then people started to understand, like, that, okay, that I get that. Yeah. But it's also just like become normal to just be afraid. And there's that too, which is like, and the longer that it goes on, the harder it's going to be to undo. So, like, I'm on purpose, like, taking my mask off with my vaccinated patients and hugging them and, like, like, showing them this is okay, if they let me, but, we agree on it. But I'm in private practice, so that's okay. But yeah, I mean, it's you talk about the unintended consequences of, like, prolonged mask use, but, like, so kids, it's good for kids to exercise. Like, we've talked about this before, but, like, when you're running and playing with a mask on, like, it is not fun. So, like, we're basically, teaching kids, like, that it's not enjoyable to exercise or have fun. It's like, I don't know. And it's not just the exercising aspect of it. It's the socializing aspect too, because, I mean, you've probably noticed too that it's like you see someone on the street and it's like maybe people are just like more like, oh, just look the other way, not get close, and I worry it becomes a habit. And especially with kids, like, if they're just like, told to stay away from their friends, how do they get over that? It becomes a muscle after a while. It gets rope memory, but I'm going to try and remain optimistic that, at least when case numbers go down, the hospitalizations go down, when we have that extra layer of a level of vaccinations within our community,
that people will just be like, you know what? The data supports this. We're good.
Right. Well, I think that's what a lot of us were hoping for in California. And now we're like, well, we're like there right now. And
but I gotta say, you guys had some of the most conservative, like ultra conservative stuff going on.
Yes. Oh gosh. And that is so interesting that you brought that up, because I was just looking at like where the most cases of MIS-C per capita were. And it looked like it was California. And I was like, oh, of course. How ironic. Like the state that had the most of their schools closed, had the most multi-system inflammatory disease related to COVID, like of any state. And I was like, that is just so ironic, but also points to the whole fact that you're more likely to get COVID, in the community than in school. So yeah, that was an aside, but
I mean, it's hard to deny the science at this point.
Yeah.
I got a couple quick hitters because I really want to hear your opinion on a couple of these things. So overall, vaccinating kids, do you have an opinion?
Yeah. So, I am definitely not someone who's like opposed to vaccinating kids. But I think, that it's going to be important to prioritize vaccinating adults. And I guess I just want to say, like, I'm not very good at looking at things from a nationalistic standpoint, just being a double citizen. And like, I'm just, that's not the way my brain works. And so when I know that like there are all these high risk adults across the world that haven't been vaccinated, it doesn't really make sense to me that when we live in a world of limited supplies that we're like hyper focused on vaccinating kids right now, when they are the lowest risk and they do spread the least. And so, I want us to get to the point where people are able to vaccinate their kids if they want to. And, but I kind of worry that we're going to get to this point of like, kids are not going to be allowed to do certain things if they are not vaccinated. And I guess that worries me. And the other thing that worries me a little bit is like, when you have a population that's so low risk for severe outcome, and then you're giving them a vaccine that has the potential of having a bad outcome, like you have a much lower threshold for saying, you know what, that's not appropriate, even if there's like a couple bad outcomes. Like if we just take the Johnson & Johnson vaccine, for example. So like there was one case that was an 18-year-old female of the central venous sinus thrombosis associated with the vaccine. And so that just made me think, wow, if we, start vaccinating lots of kids and we have like, 20 cases of that, which is, as as an ICU doctor, I mean, it can be a really devastating disease. It can kill you. It can disable you for life. Like, at what point would we say, well, like that's just way too much, that's not acceptable risk. And so it becomes an interesting risk calculus. And, looking at Israel, they just announced that they're not going to be vaccinating any children under 12. So they basically have already reached a point of like, I don't know if you call it herd immunity, but the virus is endemic. It's not like pandemic proportions there anymore. And I think that was really smart. And I kind of wish the world would take that approach unless a child is like very high risk of COVID, and just kind of like vaccinate all the high risk people. And I actually think we would find that we would get the disease under control much better. And it may not be necessary to vaccinate the kids. And if we do get to the point where we have the supplies and resources and vaccines, then yeah, I mean, I think it should, then I think kids should at least have the option of being vaccinated. And depending on the safety, maybe, we'll require them like other vaccines for schools.
Yeah. But
I don't think we need to rush it.
No, fair enough. What I'm hearing is probably we get that level of herd immunity without the young ones getting vaccinated, like the 12 and unders from the Israeli experience.
Right.
But we got to think about the cost benefit. Yeah. My personal point of view is, let's evaluate it, make sure it's safe, and then take it from there and see if.
Absolutely. Yeah. I think we agree on that.
100%. What about asymptomatic testing? I've always had a tough time with this one. Like part of me tells me, maybe it makes sense. But then when you add the false positive rates depending on like for PCR, depending on the level of COVID out in the community? Is it causing more harm than good? I actually don't know I don't truly have an opinion on this one yet. So I'm curious to hear what you think about asymptomatic testing.
Definitely, I have an opinion on this. And so the thing is with testing kids or surveillance testing in schools is, first of all, it depends on the prevalence rate in the population that you're looking at. So we already know that it's pretty low prevalence rate. Like, well, here in California, where we basically were looking at the numbers. So we, in the San Francisco school district, so we just published this in the Washington Post, but this was a private schools in San Francisco. So they were using a test with a 1% false positivity rate, the saliva-based PCR. And so their experience with testing all the children was that, I can't remember if it was 8 out of 9 or 7 out of 8, but I think it was 7 out of 8 of the positives were determined to be false positives.
7 out of the 8?
Yeah, on retesting. And so when you get to the prevalence where we have in California right now, depending on your false positivity rate, you're going to have, between, 85 to 95% false positive rate. So you're like almost, every test you do is going to be a false positive. Now, there are some tests on the market that have lower false positive rates. And I know our diocese here use the Binax Now, the Abbott one, which
the Abbott
yeah, exactly.
antigen.
And so that ended up being at $20 per student, even though it's $5. And then so we tested all the middle school students. It was like 1,000 kids, and we had one positive out of everyone, and that one was actually just a lingering positive from a prior infection. And so, our diocese decided to suspend the testing because it was like an entire day long of like 100 volunteers doing this and the supplies and like, and then, so you put on top of that. So let's say that you actually find a true positive case, the chance that is actually going to spread further in school is around 0.5%. So it's like, it ends up being very low yield because children, so children have about half the rate of actually having culturable virus if they have an actual PCR positive. And so children are just very unlikely to spread it, even if they are positive. And then the consequences are that these kids are being quarantined, like their whole class is being quarantined. And like, we're having so in San Francisco, for example, it was like they had 8 different classes that all lost over a week of school, for just the one true positive. And that true positive was like coughing and had a fever and just didn't tell anyone. So it was like, well, all of that could have been saved if we'd just been testing the symptomatic people. So, it's like, when we went from like testing a certain population for HIV, like, homosexual males or whatever in San Francisco when the prevalence was really high. And then you take it to like, I believe it was like they started testing military recruits, and then the test had 95% specificity. And then it was like 5% of all these people you tested, they ended up with a positive test, but they didn't have HIV. So it's like, we really have to be careful about what tests we're using and like what the false positive rate is. And then also acknowledge that like, even if they are true positives, like people end up being positive for a long time. And if they're asymptomatic, like out of asymptomatic people, only 0.7% spread in their own house. So it ends up, the budget that would be required to do the surveillance testing for the entire country of the United States is $42 billion. And then it's like you have to kind of continuously disrupt learning to do this every time that there's a positive. And so it's just something that needs to be really seriously considered depending on what the prevalence is where you are. And I mean, because there have been so many schools that have been open safely all along without doing the surveillance testing, it may just add, more difficult, situations and more trouble than it's worth,
Does your opinion change if the prevalence is high?
Yeah. So if the prevalence is higher, I think then you have more of a chance of the test being helpful. You have more chance of identifying a real positive. And, it's a good question, like what that threshold should be. But yeah. I would have to do a further calculation to figure it out.
But certainly when it's low prevalence, like the return on investment seems to be quite poor.
Yeah, exactly. And I mean, I love the idea of testing if kids are exposed or if they have symptoms, to make sure that they're not going to spread it further. But it is actually a big deal to be doing this. Actually, we're doing a follow-up in the Wood County, Wisconsin study where we were doing surveillance testing among the kids. And I don't really want to give away the results, but basically they couldn't get the kids to consent to do it. And then they couldn't find enough volunteers. They couldn't get the funding to actually do it. And so we just ended up saying, we're suspending the whole thing because we're really not we're finding so few cases. And we knew already from our first study that the cases were so unlikely to spread in the schools. So it was it just wasn't sustainable for the school to keep doing it.
No, it makes sense. Last question. Extracurricular activities, whether it's sports, whether it's tennis, I don't know. In terms of all we know about COVID right now and our kids, do you have an opinion towards that?
I mean, yeah, I think that we should be finding ways that we can make all the sports and extracurricular activities safe. So, I have a study coming out soon about actually indoor hockey, where we were able to minimize transmission even when kids were unmasked. And
you got to tell me that I coach hockey.
I can't give away the whole thing now, but I'll just say we didn't have any in the arena transmission after we changed protocols and had kids put on all their clothing outside before they went into the rink. And then they got to do everything, all on the rink, unmasked, as normal. And then any limited amount of spectators had to wear a mask. But it was there was an outbreak on the team and it was associated with a picture night where everyone was in a tiny room and but yeah, we're going to be publishing it.
Okay. It'll be great. Cause literally
I think it's really useful.
I was on the COVID committee. So we would have all these suggestions, all these meetings about how to handle it, our approach on ice. But no, that's great. I love the idea of, just finding a way,
yes, exactly.
You know what I mean? Set your values. What's important to you? For example, kids, my humble opinion, kids being in school, how do we do it safely? How do we do it in a way that really reduces their risk, even though, as we talked about, they're not a major source of spread, not a major source of outbreaks. But whatever we can do to try and minimize risk, let's do it. If we could be outside more, if we could.
Absolutely. And I'm a big fan of just moving things outside when you can. And, I mean, it's so much safer out there. And we already talked about the soccer study, and I'll tell you about a rugby study too, about how there were so these were adults. So, the infectious petri dishes that adults are. So there were, I believe it was 9 players were infected. So they didn't know that they were infected until they got the result back after the game. And they had cameras monitoring everyone they tackled and everything during the game. And there were no players that were found to be infected during the game, even though the players were infected and tackling each other and not wearing masks. So it was a small study, but it was okay, well, that's pretty good, So I think outdoors is outdoors, asymptomatic, is very safe.
Yeah, no, I love it. Tracy, oh my goodness, this was I've been saying this a lot lately, but this has been therapeutic. Hearing your perspective on how we have been keeping our schools safe, how we, schools have been not a major source of spread, running us through the Wood County study. And despite having those insane amount of COVID in the community, how kids remain safe in schools. I really want to commend you for your work. And, you know, if we open things up, and I know I've referred to your study 4,800 times. I'm like, look at this shit. Yeah. Come on, yo. Get the kids back to school, please.
Thank you.
I really
shout out to
it.
Amy Falk, who's the first author, actually, and she is amazing person to work with. So, yeah.
Well, thank you, Amy, too. But yeah, thanks for joining us. It means the world to us. And I hope we get to do this again, Tracy.
Oh, thank you, Kwadwo. This is awesome. Happy to be on your show. It's fun.
Wow. Tell me that wasn't full of knowledge. It was being dropped on your mind grapes. Thanks again, Tracy. That was awesome. Follow us on YouTube, Twitter, Instagram, Facebook at Kwadcast. Leave any comments at kwadcast99@gmail.com. Don't forget to check out our merch, solvinghealthcare.ca/shop. Solving Wellness, great initiative that we've been pumping out. Healthcare providers trying to address burnout. Go to solvingwellness.com. Check it out. All our fans out there, thank you so much. Stay safe out there, and we'll connect again real soon. Peace.